Tarik Jasarevic is the spokesperson for the World Health Organization, and he joins me now live from Geneva. Tarik, good to have you here with us on TRT World. I want to begin by talking about Rafah. Given the significance of the Rafah border crossing for delivering medical aid to Gaza, can you tell me the World Health Organization's contingency plans for a situation when the crossing remains closed as it is right now, especially given the ongoing humanitarian crisis?
Well, that's not an option to not have access to Gaza to deliver medical, but also other supplies. The situation in hospitals across Gaza is critical. There is a shortage of medicines. There is also a shortage of clean water. There is a shortage of fuel. And these things should come in so people in Gaza can have a basic health services. We have, alongside our other colleagues from other UN agencies and other humanitarian organizations, pre-positioned supplies at Rafah crossing border. We have surgical equipment. We have also medicines for chronic diseases. That's about 80 metric tons, and we are planning to bring more of supplies to Egyptian side of the border. What we need now is, as Secretary General has said, we need to move as quickly as possible to avert even further suffering of people in Gaza.
What are we looking at if the Rafah border crossing is not opened now?
Well, we are looking into more deaths and more suffering by people in Gaza. So right now, the hospitals are functioning beyond their capacity, and there are always new patients being brought in. There is a really last reserves of fuel that are being used. So hospitals are rationing fuel, so they can only have electricity a couple of hours per day. And you cannot have a hospital running without electricity. You need light. You need light to be able to treat patients. So fuel is equally important as it is to bring medical supplies. So there are, for example, there are 50,000 pregnant women right now in Gaza, and they need to have access to health services. There are people with chronic diseases, with disability, and not to mention people who are being injured in bombardment and who need emergency trauma care so they can have some chances of survival.
And Tarik, as you pointed out, hospitals in Gaza, in particular the Lone Cancer Facility, are sounding alarms about their dire conditions. I wonder, what is the World Health Organization's immediate strategy to address the specific needs of these critical healthcare institutions?
Well, first of all, we have pre-positioned in the before the conflict some supplies there, and we have been working and active in Gaza for many years. Unfortunately, all those supplies are now being used up. What we are calling for are three things. First one, Israel should reconsider its order to evacuate hospitals in the north of Gaza. That's practically impossible without endangering lives of patients. Secondly, we need those supplies to go through Rafah. And third, and it's really important to stress that what we need is an end to hostilities, because even if we bring medical supplies, even if we bring fuel, if people are being bombed, then obviously there will be more injuries and more fatalities. So eventually what we need is a political solution, an end to hostilities, so people on both sides can have free access to health services.
Now, Tarik, the narrative is that 20 trucks are just a drop in the ocean when it comes to Gaza's current needs. How does the World Health Organization plan to scale its aid response, ensuring that this initial batch is not just a one-off, but the beginning of sustained support?
We already have plans on bringing more planes from our logistic hub in Dubai. We are working with Egyptian authorities to get those planes to Arish, and from there would be brought to Rafah. So we have a plan on how to bring more supplies, because obviously this would be just the beginning, and as you said, it's really a drop in the ocean. But again, what we hope for is that there is cessation to hostilities, so fully health services can be restored all across Gaza.
Right, and Tarik, with the healthcare system in Gaza on the brink of collapse, what are the essential medical supplies and support the World Health Organization has prioritized for immediate delivery through the Rafah border crossing when it opens and if it opens?
Priority is obviously to treat people with injuries from bombardments. So this is like a surgical equipment. These are anesthetics. These are material to perform amputations. These are dressing for wounds. But also, we should not forget people who are on the move and who need their medicines for chronic diseases. So we are bringing those medicines too. It's difficult to single out what is needed. You know, health system is a one complete system of needs, and we need to think of all vulnerable groups: people who are on chemodialysis, newborn who are in incubators, pregnant women, as I said, people with disabilities. So we are doing our best. Right. But again, what we need right now is immediate access.
It's just truly heartbreaking. Now, Tarik, before I let you go, while the immediate focus is on the Rafah border crossing right now, the broader picture reveals a healthcare system under immense stress for years. Beyond the current crisis, what steps is the World Health Organization taking to ensure a more resilient health infrastructure in Gaza, safeguarding against future blockades of the besieged Strip?
Well, exactly. There shouldn't be any blockade of any territory, and health workers should be protected, and health workers should be able to do their job. And health workers in Gaza are very resilient. They are showing incredible resilience right now. But what they need is basically not to be a target themselves. Health workers and health facilities have to be protected, and it is protected under international humanitarian law. They need to have supplies, they need to have electricity, they need to have a clean water. So just the basic things that any hospital in any part of the world is taking for granted. So we need just to help and make sure that health workers in Gaza have the same conditions as health workers elsewhere in the world.
Tarik Jasarevic, thank you very much for talking to us here on TRT World. It's always a pleasure talking to you, sir. Thanks a lot.